Hi everyone, this is Stephen Steitler. I'm very happy to invite you to a new two-day seminar that Dr. Jared Fletcher and I will be presenting in Gainesville on July 29th and 30th. It's called Mastering the Core, Clinical Practice with the Causal Chain. You already know Dr. Jared and many of you know me as well. For those who are new to me and my teaching, I'm a licensed acupuncturist in California where I've been in continuous practice for 35 years. My specialties are integrated family practice and integrated cancer care, and virtually all of my practice centers around balancing the core. I plan to share with you my years of clinical practice using the core reflexes and causal chain analysis. I want to begin with review and enhancing your evaluation of the basic core reflexes. I realize that Dr. Fletcher will be conducting a review as well, and that's great. The more you're grounded in the basic core reflexes, the easier you'll integrate what I have to share with you in the advanced core module. I'll introduce you to 4 high priority reflexes. These are so important and potentially harmful that they often have to be balanced first to avoid severe risk to the patient. We'll then discuss the importance of the head to the causal chain, how to locate it, what significance it has to the patient, and of course how to treat it using the Korean hand magnets. I'll provide 10 clinical cases to help clarify the significance of the head of the causal chain on the rest of the adaptive systems. On day 2, Jared and I will show a very effective way to use the yin-yang balance method using only magnets. And of course, Jared and I will help you practice everything we go over during the weekend. I view the core as an underlying interconnecting adaptive network that impacts everything, your metabolism, your energy, your cell and organ activity. Imbalances of this adaptive network leads to our symptoms and our diseases. The adaptive network can be evaluated through reflex palpation and balanced with Korean hand magnet therapy, herbs, homeopathy, Bach flowers, nutrition. These are all different things I use in my practice. There's a constant crosstalk within the adaptive network as it attempts to self-regulate to daily stresses. Several members of the adaptive network may be involved in this crosstalk at any given time. One of them, however, will be the head of the causal chain and will shape the direction of the conversation. Locating and balancing the head of the causal chain allows us to reshape that same conversation within the adaptive network in a direction that promotes self-regulation. The body-mind heals best when it heals itself. It's difficult to achieve when there are various stress adaptations occurring. While necessary to counter stress, the same adaptive network can also block self-regulation by holding the body-mind in a chronic adaptive state. By balancing the adaptive stress response, we can help encourage the adaptive network self-regulation. This in turn improves clinical outcomes, especially in cases with persistent symptoms. Here are the basic core reflexes. And what you see on the screen is not a hierarchy. Any one of these can be the head of the causal chain. And that's what we'll be going over this weekend, is how to pick out which one is controlling the conversation. Although these may not be new to you, Jared and I will be spending time with you to be sure that you can effectively evaluate, locate, and determine which of these reflexes are active. So why test for the head of the causal chain? Well, first, it provides a precise starting point for our treatments. This will provide a platform for balancing treatments rather than just symptomatic treatments. It helps us to understand the epigenetic relationships of the patient to his or her environment, and it can provide background information into the lifestyle and genetics of the patient, how they live, how their systems adapt to their lifestyle choices. Here's an example of the sympathetic nervous system as head of the causal chain. This affects, in this case, the emotions, the glucose and circulatory balance of the patient. Here's an example of Oketsu as head of the causal chain, affecting the sympathetic nervous system, liver, emotional, stomach, and gut-associated lymphatic tissue balance of the patient. Here is viscerotosis as head of the causal chain, affecting the stomach, the bladder, and prostate balance of this patient. This is a condition I see frequently in my aging and overweight clients. On day 2, Jared and I will explain the use of the balance method. You'll love how fast this law of opposites method works with pain when applied through the Korean hand magnet system. We'll introduce you to the sequential steps of treatment using some ingenious ways to achieve balance. I do encourage you before the seminar to review your 6 division relationships, your husband-wife relationships, your Harari cycle and meridian sequence relationships. That will be helpful, and we'll get through this a lot faster and begin to apply it. We'll also show you various ways to use anatomical imaging, and this will widen your possibilities of success with the balance method. I hope you'll join Dr. Fletcher and myself for a very rewarding and exciting weekend training. We're looking forward to working with you, and I appreciate you taking time to listen to this invitation. Hope to see you there. Thank you.